I believe that open source has a number of benefits, a number of unique benefits over and above proprietary software. We think those benefits are particularly applicable to the care community in terms of having deeper clinician engagement in the development of software solutions, because we truly believe that those services that are co-produced by the community that are going to consume those services end up being much better services. We're entering a phase now whereby we're encouraging trusts to apply to the IDC Technology Fund in order to obtain match funding to be able to deploy open source solutions. There is quite a thriving niche community within the care community anyway who've self-developed open source solutions, and there's a number of success stories around those, in particular the Open Eyes product that's being developed at Moorfields Hospital. So at the moment we've got interest from around 50 plus trusts who are looking to put an application into IDC Technology Fund to deploy open source solutions. At NHS England we've developed a specific delivery model for open source software that gives the benefits of open source but also the assurance and surety to trusts that what they're implementing is safe and they're able to use it with confidence. There is quite a lot of evidence, particularly from the Cabinet Office, that the total cost of ownership for an open source solution is much lower than for a proprietary solution. However, that initial cash saving to, say, the IT department, because it doesn't have to pay upfront license costs, is not the primary motivation behind the NHS open source programme. We see there's many more benefits in terms of greater clinician engagement, the end-to-vendor lock-in, changes to software being made much quicker, and those changes being able to be made by a number of parties rather than just the vendor that you have the initial contract with. If you look in the United States, for example, there are some very, very large-scale implementations of full electronic health record systems on an open source platform. So I really think what tends to happen is people tend to apply different criteria to a solution because it's open source. And I think really you need to look at the solution side by side and make an appropriate decision about what's best for your organisation. We are talking to a number of significant software vendors who have got mature products in the healthcare market who are looking to offer their solution on an open source license because of the benefits to the care community and the future benefits to that organisation. So I think that really blows away the myth that open source software is not as safe or as reliable as proprietary software, because effectively what we have are a number of vendors who currently offer software on a proprietary license that are looking to offer it to the NHS on an open source license in the future. One of the reasons behind the open source programme is to add open source solutions into the mix of solutions available in the community, so there's a wider range of solutions to select from that may even be a better fit for those trusts. But there's the obvious advantages of open source, particularly trusts themselves being able to adapt and modify software to meet their particular needs. And we have a team within NHS England with subject matter experts who will be able to advise trusts, help them understand what the benefits are of open source, explain the delivery model so they can be assured that this software is as safe to use as proprietary software, and also help them with their applications into the Technology Fund in order to obtain funding to deploy those solutions. We see the Technology Fund as a significant lever to help influence the take-up of open source solutions within the NHS. So we have a team specifically to support trusts through that process, them understand the open source options. Obviously at the end of the day it's trusts that are making the ultimate decision in terms of the products that they wish to take, but if they do wish to deploy an open source solution, we'll be there to assist them through the process of applying for technology funds to deploy those solutions. The Health Insights events are within our armoury of our marketing and educational programme of open source, and we've had significant interest yet again from trusts, from those wanting to understand more about open source to those who are quite clued up about it and are very keen and excited about the opportunity to take a piece of software, refine it that meets their needs and implement it within their trust. I think we all understand the advantages around having a digital NHS, particularly the opportunities around data for decision support for clinicians. In order to make best use of that data, it's got to be captured in a structured way. And obviously to do that, clinicians have got to have systems that are useful for them and that are usable for them in order for those systems to be used. So we really believe that by having useful and usable systems, they will be used, data will be captured, and we'll have a far, far greater benefit from the data.